have a Google of the university, have a look at the sort of about pass rates as well and employability rates. Usually they post these online, but most of all, you have to like the university, you have to like the people you're going to be spending the next 3 years with. You're going to have to feel comfortable, you're going to have to make sure it's accessible, good support network, all of that before anything else. So just make sure this university is right for you. Don't go by what your parents are telling you, don't go by what your friends are saying, this is better than this. Do your own work, do your own investigations, and whichever one is right for you, just go for that.
Let's be honest, if you've gotten an interview, you probably know what they want, and it's in your personal statement. So know your personal statement and just like know what they want on their website. So go on their website and see what they're looking for within a student. And yeah, ask loads of questions. Make sure you have questions. That's always a good tip for any interviews, have questions, but also have answers to questions. With midwifery, a lot of universities do multi-mini interviews, so MMIs, and they ask you a bunch of scenario questions. So make sure you are able to explain yourself and show like you're working out basically, but speak it. So they will ask you scenario questions on an array of things. Some might not even be relevant to the degree. Make sure you just say like why you would do that, or how you feel, why you would feel that way, or whatever it is. And that is always good, because I want to see like, do you have any unconscious biases that you don't know about? Does this person reason well? Like, are they good? Like, do they have a conscience? Like, is their conscience telling them actually no, you should do this instead? Like, they want to see all those things about you.
Irrespective of if you are an adult nurse, a children's nurse, a learning disability nurse, or a mental health nurse, at some point in your 3-year course, you will be undertaking these kind of exams. Number 1, general nursing exams. Number 2, anatomy and physiology exams. Number 3, OSCEs. These stand for Objective Structural Clinical Examinations and are practical assessments on how you perform clinical skills. Number 4, the all-important drug calculation exams. And lastly, your placements. Now, that's quite a lot of assessment methods and quite a lot of different examinations, but this is what we need to do in order to become nurses in the UK. And trust me, once you've done all those exams, all those placements, it will be worth it in the end.
As soon as you find out where your placement's going to be, which should be a minimum of, I think it's 2 weeks in advance, but hopefully you will find out sooner than that. As soon as you find out, contact your placement. Don't email them, phone them, because sometimes emails get missed. People are, off sick, on leave. I know it can be scary making a phone call sometimes, but I believe in you guys, you can do this. Give them a ring, introduce yourself, say that you're a new student nurse starting soon, and preferably try and arrange to go and visit before you start your placement. I visited all my placements before I actually started there, and I found that really helped to make me that little bit more confident on that first day. This way you get to test out the route to get there, find out where the ward is, work out which bus or train or road you need to take to get there, where you can park. It should also mean that you know a couple of people's names and faces before you arrive on your first day. It's going to show that you're keen, which is immediately going to give your new placement a good first impression of you. It also means you've got a chance to ask questions, which again is going to boost your confidence.
Don't forget to ask questions, and don't be shy to ask questions. Honestly, it's something that I'm still working on myself. Sometimes you may feel like you don't want to interrupt the nurses by asking them questions about what they're doing or what they're trying to show you. You might feel like you might sound stupid if you're asking something that you might be scared they think is a bit simple, or that is something that you should know already. But honestly, no question is a stupid question. It's better for you to ask something and find out the answer than to not know, and that could be something that's actually really important to know. So don't be afraid, because no one's going to judge you for it, and it's for your learning. So ask questions.
Do not over revise. I've done this last year during my second year. I found myself over revising. I was on it every single day, so obsessed with revision, and it got to a point, I think it was about 2 weeks before my exam, I got to a point I physically couldn't revise anymore. It was stressing me out so much, I physically couldn't look at it. I was like, do you know what, I can't do this anymore. So I literally, for the last 2 weeks before the exam, I did not revise. And so that's really important. You need to sort of manage it in small sections. You can't just overload yourself with all of the information all at once, because that's not going to help your anxiety levels at all. Didn't help mine. So just make sure that you revise sensibly, if that makes sense.
Picking your dissertation subjects. I have 2 key points to bear in mind when picking your topic. Number 1, Pick a topic that you are passionate about. This is what I did. For example, if you are interested in emergency care and know that one day you wish to become an A&E nurse, then it would be a great idea to pick your dissertation topic based on emergency care. That way you are going to be putting in work into a topic that you love and are really passionate about, and you can even write about it in your future job application. So just bear that in mind. My second key point when trying to decide on a topic for your dissertation is pick a topic where you know you're going to find lots of literature and research on. For example, topics like sepsis or caring for a patient with acute kidney injury.
I think the main thing when you are a student nurse, which is actually really beneficial, is to have a goal, and whether that be a goal towards placement or essays or exams or just for your future as a nurse, I think having something to strive towards actually really helps, because it is really difficult sometimes being a student nurse, and sometimes it's so easy to get bogged down with the essay you have, or if you're having a hard time at placement. But having that kind of final goal is something to look towards and kind of a light at the end of the tunnel, in a sense that it just makes you realize that everything is not bad and things will get better, and eventually there will be something that you can achieve and reach. So I think having a goal is a really, really good one. And like I said, whether that be really, really small, like, oh, I want to manage an airway in placement, or whether that be one day I want to be an oncology nurse practitioner or something like that. It can be small or big, but I think having a goal is a really good one.
I have no doubt that all the people watching this are going to be fabulous nurses in the future. We just need to get you there.
At the end of the day, this is your life, your decision, your amazing journey into nursing, and you want it to be perfect.